Hello, today's video is on dosing strategies, building on the prior video talking about routes of administration or ways to get a psychedelic, in this case ketamine, into someone's bloodstream. So at the end of the last video, we talked about the flexibility of ketamine as a psychedelic, the different routes of administration and the pros and cons of those, and the different ways they could affect the subjective experience of the client in a psychedelic medicine session. So I hope one of the things you learned from that video is the ability with skill to create or specify the type of psychedelic experience that your client wants to have as far as how the dosing strategy is approached. So given that we have these different ways of administering or using ketamine, today's video is about the why. Why would we pick a particular dose or a particular dose range? And how do we understand how the dose strategy works for the overall therapeutic experience? So, in service of this, I'm actually going to show you some old footage of me live teaching this concept. You'll have to excuse the video quality, as I do still stand behind the content. To introduce this, I want you to track for a couple of concepts. The first is the somewhat controversial or widely misunderstood idea of what is the role of the therapist. We know that psychedelics can be healing for a person, and that the psychedelic experience can connect a client, connect any of us, with aspects of ourself in a different way than we can when we're in our everyday sober mindset. So when someone is on a psychedelic, we understand that they're connecting with themselves in a different way, with aspects of themselves that may not have been conscious to them, or with guidance or inner healing wisdom that they have within them, that they can't access in their ordinary awareness. Sometimes this is talked about as a relationship with the medicine, a healing relationship. Some people prefer to think of it as a relationship between themselves and themselves, a deeper awareness of themselves or a deeper understanding of themselves. However we prefer to conceptualize that, it's clear that that element of the healing experience, that dialogue that happens in the room between the client and the client, is a powerful part of what makes psychedelic-assisted psychotherapy effective and different. Given that we understand this, collectively there's a little bit of confusion about what is the role of the therapist. If so much of the healing is taking place within this new dialogue the client has created within themselves, what is the role of the therapist as the second person in the room? And how is that different from traditional psychotherapy? So today's video is going to be a little bit about that concept. What is the role of the therapist? And in service of introducing this, I'd like you to track for understanding another concept, which is that of the psycholytic dose range. Psychedelic versus psycholytic dosing. So without further ado, let me introduce the video and we'll check in at the end. Thank you. Hey guys. Okay, so this lecture is going to be a little bit different from some of the didactics that we have done before. So I'm going to be using some of what I've drawn behind me, but just ignore that for now. Because I want to give you guys a little introduction to some concepts. Up until now, we have done talks about ketamine as a medicine, and also given you guys a lot of opportunity to experience that. So I think at this point with this group, you guys have had a couple of intramuscular experiences, a couple of IV experiences, a nasal experience with nasal, and I think we have the group experience with the lozenges coming up pretty soon, getting that scheduled. So you guys have had a chance to be in the space, get to know yourself in the psychedelic space, to see what that feels like, how to navigate that. And you've also had a chance to sit with each other or with clients who are on ketamine and in the psychedelic space. So quite a few of you are seeing clients under supervision at this point, so you've got a sense of like how these sessions are rolling. So this is a good time to sit down and say, okay, we get a feel for the medicine, and we understand what ketamine is and its history and its context within other psychedelics in the sense of psychedelic therapy. So today is really a little bit of a reframing of what does it mean to be a psychedelic-assisted psychotherapist? So today as we're talking about you guys' skills as therapists moving into this space. Because it is not the same as psychotherapy with someone who is in the sober state, which many of you guys are already skilled at. And it's not really the same as just holding space for someone while they're having a intense trip experience, which is often the skill set that's taught on the underground. You know, as a guide, someone called a guide or a trip sitter, that's a beautiful skill set, but that's not exactly what we're teaching here either. It's really a third thing. And so we're going to talk a little bit about what I mean by that and ways that you guys' backgrounds with those different skill sets and also some of your preconceptions may be derailing you a bit in this work as the common sort of errors that I see people make in the way that they approach it or conceptualize it and sort of what to do about that. So part of this talk today is about kind of finding yourself, where you fall on this spectrum, and what that means about where you want to focus your skill set building from here. What is it you're already doing well, and what is it that you would need to tweak to be good at this as an individual? Different among you are coming in with a little bit different backgrounds with this, and that's pretty common in trainings. And so I'm going to address all of that. I've learned from experience to sort of understand that you guys are going to roughly fall into two camps with assumption errors. So let's talk a little bit about that today. Before I get into this conceptual overview stuff, I do want to do a quick review on the didactic lecture we had quite a while back on ketamine with the kinetics of it, the routes of administration and how that affects how you move through a session with the client's blood levels and the intensity of their experience. So I'm going to touch on some of that. Some of this you've seen before, but I'm going to remind you because it's going to be important for the second piece that I want to make sure you guys get out of this today. So behind me I've gotten a graph that you guys have seen before. Let me move over to this side. Down here is the session time. This is you moving through the session, and on this level I have the blood level of the medicine, or which basically essentially equals the intensity of the experience. And so what I've done here is drawn a couple of color-coded graph lines for what this looks like with different routes of administration, different ways of dosing, ketamine in particular. Though a lot of this can be extrapolated to the other psychedelics as well. And we could certainly talk about that in the question and answer time if you guys want to break that down a little bit. So what I've drawn here is a reminder that in a typical session, now these are not drawn to be numerically exact, these conceptual, so you guys can have this concept of what I'm trying to convey here. But in a typical session going across here, one of the common routes that you see out there right now, especially with ketamine, is intramuscular or a one-time injection. This is going to be the one that's going to shoot you up the highest with the dose intensity the most rapidly, and it's going to then come down at a pretty exponentially sort of proportional straight line as it starts to leave your bloodstream. So the curve looks like this. At this level, the person's having a more of the peak experience, a more of the intense psychedelic experience. Down here, they're mostly sobering up. Some people will use this time here as like almost early integration time. And so this creates there's a zone in here where they're a little bit more in the in-between state, and that's the zone we're going to talk about. With this purple line here is the lozenge or the sublingual route, and you can see that this curve here is a little bit more gradual, sloping, and level. It's not as much of a peak, and it doesn't kick in as intensely either. This is going to be important for the conversation we're going to have about what is your sort of optimal sweet spot for doses and the different ways that you administer ketamine in particular. So obviously this depends on the dose, right? So if I give you a higher dose of a lozenge, this purple line, your curve's going to be up here because it's stronger. If I give you a really mild lozenge, you'll be down here. So really what I'm noting here is the shapes of these. And what I've drawn here is the typical dose ranges that we use in our clinic. So you can see that we're sort of trying to hit around this imaginary dotted line here that I'm going to talk about a little bit more. Okay, so down here with this little green curve, if you can see that, you've got a not as abrupt but relatively quick rise and a quick down. This is the nasal spray. Clearly also depends on the dose. You could make it higher or lower, but it's going to kick in about that quickly and wear off about that quickly. So you don't often see this used in psychedelic-assisted psychotherapy or ketamine-assisted psychotherapy sessions because it's short and it tends to be lower. It's not easy to get a lot of nasal spray in you to get up to here. Now, I would argue that this is very doable, actually. We do use nasal spray for ketamine-assisted psychotherapy in our clinic. Basically, you give it as a stronger dose, so it raises it up, and you redose it throughout the session. So you're actually hitting curve, 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 and you can hit this zone right here.
We haven't trained you guys on that yet. That's something we can talk about going a little bit forward. It's a less common way to use ketamine for therapy with the nasal spray, but it is more accessible to people. And if you can work with some of the logistic hurdles of it, it's a viable option that not a lot of people talk about. Down here in this little brown line, just for reference, I've put microdosing. This is the way that you typically hear nasal spray prescribed, like with the Johnson & Johnson product. You're periodically taking a low dose, and you're essentially, for an antidepressant or other clinical effect, that's a microdosing strategy. It's a similar strategy to what you hear on the underground with microdosing mushrooms or LSD or so on. It's like it's lifting your mood, but you're not really hitting a psychedelic or psycholytic dose, which is something we're going to talk a little bit more about today. And so the last curve here is the orange one, if you can see this. This is the IV or intravenous route. This is our favorite for ketamine-assisted psychotherapy, frankly, because you can really control staying in a certain dose range for the longest amount of time. So you've seen this line is kind of wavering up and down. It's staying right around here. Now, this isn't necessary. You can hit this dose zone with lozenges. You could, like I said, hit it with nasal spray with repeating and doing stronger doses. But you cannot really do this with the injection. You can see if you give a stronger injection, you're going to be up here, but you're really still going to have this abrupt drop off. Or you're going to be down here where you never really hit a very psychedelic level. So I actually, the IM, or the intramuscular route, is one of our least favorite routes for ketamine-assisted psychotherapy, even though that's a commonly used one out there. And I think that it's important to talk about that because a lot of people come in with the conception of, they've either been trained on this or their concept of how psychedelic-assisted psychotherapy works is this. And what this really is getting someone more of a peak experience and then integrating it. You're not having a lot of useful psychotherapy time. Your window is much smaller. You may have the 20-minute or so in those sessions of really what I would call ideal dose for therapy purposes. Now ketamine, unlike MDMA and psilocybin and a lot of these things we're learning about, ketamine is fast. So you're doing all of this in a therapy hour. Your window for having useful psychotherapy time is going to be shorter with this. So given that this is one of the more common routes out there, I think it's important to say that about the fact that it's just really not as useful for this particular purpose. So maybe we'll see that landscape changing over time. So you'll see this dotted line I've drawn here. I'm going to take a red marker and say that what that is about is we're sort of arbitrarily dividing this into lower dose experiences like nasal spray, microdosing all the way down here, and higher dose experiences, which the injection often hits even in clinical settings because of the intensity of that first onset peak. Obviously, I could take the dose up of the IV, this orange line, and have it up here, and it'd be very strong. Same with the lozenge. You could have a stronger lozenge and so on. But in the typical doses that we use in our clinic and that you tend to hear talked about in the world of psychedelic-assisted psychotherapy, these are kind of typically the dose ranges that you would see. This is the idea of that. So over here, we're going to say that this area right here, I'm going to put it here and here. So I'm going to really just emphasize this to make sure that you guys can see it. We're going to call this our kind of sweet spot for psychedelic-assisted psychotherapy. So this is the dose range that we want to be in. And what is this all about? You kind of want, I'm going to draw this box all the way over here for the purposes of this talk and say that we kind of want to, if we want to do good therapy work with someone on a psychedelic, we want to stay in this range, just sort of just above and below this imaginary black line. And what do we call that in sort of psychedelic, psychotherapy parlance? This is your psycholytic dose ranges down here, and this is the psychedelic. So I'm going to introduce those two terms. I'm going to write that on here. Let's say that below this dotted line, this is psycholytic, which many of you may be familiar with this term, and above this is psychedelic, which is a term we obviously use much more often. It's important to understand this though, because there is an idea out there, and I think some of you have come in with this idea, that psychedelic-assisted psychotherapy, by definition, is done in a psychedelic dose range. or dose zone, like the person is in a psychedelic state. Yes and no. You can put someone in a psychedelic dose range and have a peak experience, a mystical experience. You know, we all love these, and many of us know these and know the power and the transformative capability of the peak experience, right? And so a lot of people out there, when they talk about psychedelic-assisted psychotherapy, what they're really imagining is, we give someone a psychedelic, they have a peak experience, and then later we do integration on that. You know, so we do preparation, we have a peak experience, and we do integration. Yes, and that is commonly done, and that can be very valuable and very beautiful. But I would argue that is not technically psychedelic-assisted psychotherapy. That's giving someone a trip or a peak experience and integrating it. And so the skill set required for that while you're actually in the session, in the dosing session with the client, is really the skill set of the trip sitter, someone who's holding space. You see, and a lot of the people who do that really well are come from the trainings in the underground and have sat with a lot of people. And so that's a beautiful and powerful role. And some of that skill set can transfer into this work. But it's not the same thing. Psychedelic-assisted psychotherapy is really doing psychotherapy on what is really more a psycholytic dose. So what is this dose range under this black line here? The psycholytic dose range. This is where the person can talk to you. They can potentially, especially on some of these medicines, sit up or interact. They can follow your train of thought and their own coherently and logically. They can have a dialogue. They can conceptualize working on a goal, for example. All of that while being affected by the psychedelic. So they are not in a sober state. That would be no medicine at all, or maybe something like someone microdosing. You would say they wouldn't feel it at all. People in a psycholytic dose, they feel the medicine. They feel that their frame of reference is a little different, that they're softer, that it's a little more heart-opening, their defenses are a little loosened. They're often able to see the meta picture, make conclusions easier, or see big patterns more easily. They're able to sit with triggering content more easily. So there are real effects of the medicine in this dose range, in the psycholytic dose range. But they know where they are, they know that they're talking to you, and they know that they're in a therapy session. So that's kind of a way of thinking about it. When you get up to these higher dose ranges, you're often in ranges where people take doses more recreationally or with the intention of having a mystical or peak experience, which is, like I said, also valuable, but not necessarily the skill set that we're teaching in here today. So these dose ranges are often powerful, ego-dissolving, what we think of as more mystical experiences, or more intense experiences that are not quite to that level, but still you're altered enough that you may have less of a sense of being present in the room. You may leave your identity with yourself in a kind of ego-conscious way. You're very outside your life, and this experience is more psychedelic, and it's very powerful. But if you get too psychedelic in a therapy session, they're not going to be able to benefit from you being there as a therapist. You may as well be a trip sitter, because they're going to be having their own journey. And that is beautiful and valuable, and maybe should be incorporated into working with people in some ways. But that needs to not be our only skill set. So a lot of people come into training thinking, this is where the power is. We need to stay up here because this is where all the powerful stuff happens. And what I want to let you know is that the data doesn't show that. That hasn't been our experience in this clinic, and it hasn't been the experience by other people who've done a lot of work in the field. I was just in a training with the Mithoffers talking about their MDMA work, and they've had the exact same experience. Their data has shown that people who get the MDMA work in this dose range down here actually have the better outcomes. They have more symptom reduction, and they have more longer term sustainability of their recovery. Whereas up here, you're often seeing people have these amazing intense experiences. They will leave the session, and I speak from experience here, saying that was the most powerful thing in my life. And that's very gratifying. That's gratifying for the client, that's gratifying for you as a therapist, but a month later, they're not gonna have a lot of change in their symptoms. And this is really important. I think a lot of people misunderstand this. They think, oh, the mystical experience is healing. The mystical experience is profound, moving, and potentially healing. But it is not psychedelic-assisted psychotherapy. And I've underlined those words here because people think that psychedelic therapy is giving someone a psychedelic and giving them a psychedelic experience and they're healed. what I'm talking about is psychotherapy assisted by psychedelics. So you are doing psychotherapy with this person. You're working on their trauma or whatever their treatment goals are under the influence of a psychedelic to a level that the person feels it and you feel it. So this is important in sort of dismantling some of the assumptions we have. And I know from experience that a lot of people don't like me saying that the mystical experiences is not the point of this work. So a lot of you are going to disagree with me on that, and feel free to do so. But I think you will learn otherwise if you develop this skill set down here. Because what you will find out is that you have better outcomes. Your clients will actually do better over time. They'll actually have more permanent change because you're bringing in actual psychotherapeutic interventions into this space, which is the important thing. So now that I've drilled that home and maybe shaken up some of you guys' preferred assumptions about this work, let's talk about some of this in a little more, expand a little on this. So this red box is our ideal dose zone for working with a client in the office setting. Now, to go back to routes of administration, which you guys as therapists don't need to know as much about as we do as physicians, I think it is pretty obvious that this orange line can stay here pretty easily because you can kind of control it. This is the IV or intravenous route. You can kind of control what dose you hit, and you can kind of control how long you stay there with an IV. It's very titratable even in the session, which makes it very flexible, and we have sort of evolved over time to really prefer it for that reason. But you can also see that a lozenge can hit here pretty easily, and that's a commonly used one. I've already said I don't love the intramuscular route because, as you can see, your kind of useful time is from here to here. It's a short time frame during the session that you really have useful experience, and what you're often doing in that time is processing what happened up here in the peak experience, which, depending on how high you go with the peak experience, they don't have a lot of recall of. So often the person doesn't remember this fully, and you may be prompting them. There's value to that. One of the things we teach in this training is how to help people remember peak experiences and so on. So there's value to that. But you're not doing a lot of psychotherapy around their presenting complaint, right? Their treatment goals. That window is kind of lower. And like I said, you can get up there with a nasal spray. So there's different ways we can get you there. Like, you're in the room as a therapist, there's different ways that we can get you there as physicians to get the blood levels into the client, so to speak. What I need to talk to you guys about going forward in this segment of the training that we haven't done yet is, what are you doing in here? What is the skill set in here? Okay? Because down here below this red bar, down here in this mild area, you've got microdosing people, you've got even people with lower dose, things like nasal spray you could use. These are the lower dose experience down below this red bar. You could really do pretty traditional psychotherapy in here. If you're a good psychotherapist, you could do therapy with someone. They're very mildly affected, and that would probably work. And up here, in this place, a lot of us have experienced this on underground work, right? A lot of you guys coming in have done this, and you have that frame of reference, so it's really valuable and important to talk about it. People having more intense experiences, peak experiences, and you are essentially sitting, holding space, playing the role of what's called a trip sitter, or often a guide. Up here, that skill set comes in. If someone is on a dose, whether it's an IV or IM or anything else, and they're hitting up here just because of the intensity of the dose, you need to drop into the skill set where you're just holding space in a good, healthy way. And we can talk about and train on what that is. If someone is down here, you can kind of just talk at them. You can do therapy. But, and this is important, in this red zone, neither of those skill sets is really exactly what you're doing. You're doing a third thing. And hardly anybody comes in with this particular skill set, because why? We're not taught this anywhere. We learn this in school. We learn this in the underground. We're not taught what to do in that middle zone, which is where someone is weaving in and out of from psycholytic to psychedelic, right? I really like IV here, this orange line, because they're sort of in and out. They're a little bit psychedelic, and then more psycholytic, more psychedelic, more psycholytic. And you can see you can do this with various methods. But what you're seeing in this red bar zone, what you're seeing clinically, is someone who can close their eyes and go kind of deep and have a very powerful psychedelic-like experience, but then can open their eyes and kind of talk to you about what they just saw or experienced, and that you as a therapist can prompt them to go back in and to use what they're experiencing to try things or to sit with things in a certain way. There are prompts that you can do so that they're moving in and out of that zone, and you as a therapist are sort of helping them navigate that and helping guide that. Then if there's a time in the session where the dose goes really high and they're really overwhelmed, then you need to back up and you're mostly holding space. And then when they are sobering up a lot, you're doing a lot more early integration or sort of talking. And if you do a good job with the dose staying in this range, you're going to spend a lot of time with them waving in and out of psychedelic, psycholytic, that kind of threshold zone throughout the session hour. And with ketamine, it really is a session hour, unlike MDMA or psilocybin where you're spending a lot more time with the client. These are relatively fast-acting experiences, and so you're having multiple of these. And this zone right here is a different skill set. So here's the two kind of assumption errors that I see trainees come in with, and most of you probably fall into one of these baskets if you do some self-reflection. I have a sense of who's who in this particular group, but this is just how it is because, like I said, there's no school for teaching this. This is what we're trying to do here, is teach this, because you guys have learned either this or this. And some of you actually have learned both of this, because quite a few of you are psychotherapists that have actually also worked in the underground and doing really good work in the underground. So you've got these two amazing skill sets. And how do you combine that to be this third thing? So the two baskets are, you're either overdoing this or you're overdoing this. So there's a couple of you who are, we're putting people in this dose zone, right? We're giving the IV, or we're giving someone in this sort of sweet spot where you could talk and then talk less, and you can kind of weave some therapy in an appropriate way. And you guys are mostly just trip sitting or holding space. You're not interacting enough with the client because you haven't been trained to do that and how to do that. You're focusing much more on the ceremonial space holding piece, which is very valuable. And you're allowing the client to sort of have their own experience, and you're really doing most of the psychotherapy the next day in integration. So you're sitting in the room with the client, there's a lot of silence and there's a lot of maybe music, and you're just letting them sort of have their experience. That can be valuable, but you're basically using the skill set that is best used up here. And what's happening there accidentally is you're actually underserving your client because you're missing out on therapeutic opportunities here that are available in this dose zone. So the other sort of error basket that I see new trainees fall into is down here. This one is equally common. These are people who are often really skilled therapists, and they know how to do therapy really well. So what they're doing is they're coming in and talking at the client as if you're in a typical therapy session while the client is in and out of a psychedelic dose range. So what happens with this is that you're basically over-therapizing, right? You're overdoing the therapy in here. And that actually is quite jarring for the client. Because what the client is trying to do is have these profound, deeper psychedelic experiences in this zone, and to be able to sort of process and sit with and sort of follow the trajectory of what's intuitively happening for them. And what you're doing down here is bringing in therapy interventions that you would use with regular clients who are sober, and trying to get them to follow that reasoning or that line of thought while they're in this dose range. So that is not going to work because it's unsettling or jarring for the client, and often ends up being frustrating for the therapist, because what you'll often see is something like the client's inner guidance is starting to show up in the form of some sort of psychedelic-like experience or insight. And their intuition would be to kind of follow that, or it's naturally taking its own course. And the therapist keeps talking or bringing some sort of paradigm into the room that kind of pulls that client off of where their psyche is sort of intuitively trying to go. And this is jarring, and it also creates almost like a low level of frustration or anxiety often in the client, because they can't follow the train of thought of the therapist the way they normally would be able to. They're not in that state of mind. They're in a more expanded awareness state. And the therapist is almost trying to bring them back into a more narrower awareness state accidentally by the way that they're talking or interacting. And so this is sort of error basket number 2. So I guarantee you that to some degree most of you are probably doing one or both of those types of errors. And so what is the middle zone here? That is the skill set that we want to talk about in this next section of lectures. So what I've done here is sort of conceptualize it for you, let you take this and reflect a little bit on it and say, which of these do I tend to do, and how am I bringing my background into this work in a way that might be biasing me a little bit? And then what do I do to learn this skill set, right? So I know it's easy for me to say, hey, you guys need a skill set for in here, and I haven't given it to you yet, but that is the intention, is to talk about that in more detail and actually break it down. What do you actually do in here? But for now, what I want to share with you is that most of you are trying to do this too much or trying to do that too much. And those are the opposite ends of that. I think that covers what I wanted to talk about in this particular moment. I will make one quick note about memory and recall. We've touched on this before, but it's been a little while, in that part of this dose is designed to be able to interact with the client around the psychedelic experience, but also so that they will remember most of it. So when you get up to these higher dose ranges, people don't tend to remember as well what they experienced, even if it was profound and powerful. Oftentimes the therapist remembers it and the client doesn't remember it at all. So though that can be healing also, right? So this is me not saying those experiences are bad. It's not ideal for this particular skill set, psychedelic-assisted psychotherapy. So this zone is about being able to experience the psychedelic reality but also process it, and this zone is also about being able to pretty much remember the majority of your session when you come out. And that actually makes it more valuable for integration in a psychotherapy context. So in conclusion, I would say the reminder is that what we're doing here is actually psychotherapy. You don't hear that explained enough out there, and in the sort of the narratives out there around psychedelic work right now. But I think to the extent that there are measurable outcomes in different academic settings and with different medicines so far, that's showing that this model is accurate. So we're going to end for today, take a break, and so then regather to do questions and answers and so on. But I think the important thing for today is reframing in the way that I've described, and then all of us sort of pivoting and starting to talk about this particular skill set, especially now that some of you are seeing clients and can start applying this particular skill set that may be a little bit edgier or newer for you than what you're sort of default doing. So I'm going to end here, and then we'll come back and do questions and answers. Thank you.
So welcome back. That's an old video, but I hope useful in explaining this really critical concept when you're starting training in psychedelic-assisted psychotherapy. I hope it was informative, and if it shook a little bit of your preconceptions, I hope that will allow you to have some curiosity going forward to see what else you can learn. I'll see you in the next video.